Hello, everyone, and welcome back to Expert Living. We're your go-to channel for reliable health insights that empower you to live your healthiest, happiest life. Today, we're tackling a topic that affects millions of people worldwide: heart disease. Heart disease is a major health concern, but the good news is that early diagnosis can make all the difference. Knowing which tests are available and understanding how they work can help you and your loved ones take proactive steps toward a healthier heart. So, stick with us as we walk you through the importance of early diagnosis and the most effective tests to detect heart disease early. The importance of early detection in heart disease. Why is early detection in heart disease so critical? Heart disease often progresses quietly, developing over the years without any clear symptoms. Many people don't realize they have a heart condition until they experience severe symptoms, like chest pain or even a heart attack. By that time, the disease is usually in an advanced stage, making it harder to treat and manage. Early diagnosis provides a window of opportunity to address potential heart issues before they become life-threatening. Early detection isn't just about discovering issues, it's about prevention and empowerment. With a proper diagnosis, individuals can take specific actions to halt disease progression. Lifestyle adjustments, medication, and regular monitoring can drastically improve a person's quality of life. This proactive approach also allows for better resource allocation within healthcare systems, reducing the burden of treating advanced heart disease. Understanding risk factors and their role in testing heart disease affects people differently, and not everyone has the same risk level. Some factors like family history, age, and gender are beyond our control, but others like smoking, poor diet, and lack of exercise are within our power to change. Recognizing individual risk factors is crucial, as it guides the choice of diagnostic tests. When a healthcare provider understands a patient's unique risk profile, they can recommend tests that offer the most value for that individual. High blood pressure, high cholesterol, diabetes, and obesity are some of the leading modifiable risk factors for heart disease. Each of these factors has the potential to accelerate the development of heart disease. Doctors take these risks into account when designing a personalized testing approach. For instance, individuals with diabetes are more prone to artery blockages, making imaging tests like coronary calcium scans highly relevant for them. Electrocardiogram, ECG or EKG, an electrocardiogram, commonly known as an ECG or EKG, is often the starting point in heart diagnostics. This non-invasive test records the electrical activity of the heart and can detect abnormalities in heart rate and rhythm. When a person has heart palpitations, irregular heartbeats, or unexplained chest pain, an ECG can offer quick, initial insights. It helps detect conditions such as arrhythmias, ischemia, and in some cases, even past heart attacks. The ECG is typically conducted in a clinical setting and takes just a few minutes. Beyond its simplicity, the ECG is valuable because it can serve as a baseline for future heart health monitoring. Regular ECGs can reveal changes over time, alerting doctors to subtle shifts that may indicate developing issues. Though it's not a conclusive test for all types of heart disease, the ECG is an accessible, informative tool that opens the door for more detailed testing if necessary. Echocardiogram. The echocardiogram is a sophisticated imaging tool that uses ultrasound waves to create a live image of the heart's structure and function. This test is non-invasive and painless, making it ideal for patients who need frequent monitoring. An echocardiogram offers a view of the heart's chambers, walls, valves, and blood flow, helping doctors spot abnormalities in these areas. It's especially useful for identifying conditions like cardiomyopathy, valve defects, and heart muscle weakness. There are various types of echocardiograms, each suited for different diagnostic purposes. A transthoracic echocardiogram, where the probe is placed on the chest, is the most common form. In contrast, a transesophageal echocardiogram involves inserting a probe down the throat for a closer look at the heart's structure. Stress echocardiograms, which capture images of the heart under exercise conditions, provide insight into how the heart functions when it's working hard, identifying conditions that might not be visible when the heart is at rest. Stress testing, often referred to as an exercise stress test, evaluates the heart's performance under physical strain. During this test, patients typically walk or run on a treadmill or pedal a stationary bike, while medical staff monitor their heart rate, rhythm, and blood pressure. An ECG machine records the heart's electrical activity, providing real-time insights into how the heart handles the increased demand for blood and oxygen. This test is beneficial for detecting ischemia, which is a reduction in blood flow to the heart. In some cases, doctors might use pharmacological agents to simulate the effects of exercise on the heart if a patient is unable to perform physical activities. This allows for a broader range of patients to benefit from stress testing. Stress testing is particularly helpful for people who experience symptoms like chest pain or shortness of breath during exercise, as it can reveal issues that might go undetected in a resting state. Blood tests for heart disease. Blood tests are foundational in heart disease diagnosis. These tests evaluate various biomarkers, which can signal the presence of inflammation, cholesterol buildup, and other risk factors for heart disease. The lipid profile test, which measures levels of LDL, bad cholesterol, HDL, good cholesterol, and triglycerides, is one of the most common. High levels of LDL and triglycerides contribute to plaque formation in arteries, narrowing the vessels and increasing the risk of a heart attack. The high-sensitivity C-reactive protein, HSCRP, test is another important blood test for assessing heart disease risk. CRP is a protein released by the liver in response to inflammation. Elevated levels of CRP, especially HSCRP, may indicate inflammation in the blood vessels, a known precursor to atherosclerosis. Another blood test to consider is the NT-proBNP, which measures levels of a hormone released by the heart during times of stress. Elevated NT-proBNP levels can indicate heart failure or damage to the heart muscle. Coronary calcium scan. A coronary calcium scan, also called a heart scan, utilizes CT technology to detect calcium deposits in the coronary arteries. Calcium in the arteries is a hallmark of atherosclerosis, a buildup of plaque that narrows arteries and restricts blood flow. By measuring calcium levels, the scan provides a coronary calcium score, giving an estimate of the extent of plaque buildup. A high calcium score indicates a higher risk of heart disease, even in people without symptoms. Coronary calcium scans are particularly valuable for people who are at intermediate risk of heart disease, meaning they have several risk factors but no clear symptoms. The scan is painless, quick, and non-invasive, providing a detailed look at the coronary arteries without the need for invasive procedures. The results can guide doctors in recommending preventive strategies or treatments to reduce cardiovascular risk. Coronary angiography for patients with significant symptoms or confirmed risk factors. Coronary angiography provides a detailed look at the coronary arteries. This invasive procedure involves inserting a catheter through an artery in the groin, arm, or neck and guiding it to the heart. Once in place, a contrast dye is injected, making the arteries visible on an X-ray screen. This procedure is highly effective for identifying blockages and narrowing within the coronary arteries. While coronary angiography is often reserved for patients with severe symptoms, it's also used in cases where other tests suggest a high risk of a heart attack. The procedure carries some risks, such as bleeding or infection, but the information it provides is invaluable for planning treatments like angioplasty or coronary bypass surgery. Court angiography and MRI. CT angiography and MRI are advanced imaging techniques that offer detailed views of the heart and its blood vessels. Unlike traditional angiography, these techniques are non-invasive, making them a safer option for many patients. Court angiography involves injecting a contrast dye, followed by a series of X-ray images that produce cross-sectional views of the heart and arteries. It's highly accurate for spotting blockages and plaques. MRI, on the other hand, uses magnets and radio waves to create detailed images of the heart's soft tissues. This is particularly useful for assessing heart muscle damage, blood flow issues, and congenital heart defects. Court and MRI are both ideal options for individuals who require detailed imaging but cannot undergo invasive procedures due to health concerns. Genetic testing. For those with a family history of heart disease, genetic testing offers insight into inherited risks. Specific gene mutations, like those associated with familial hypercholesterolemia or cardiomyopathies, increase the likelihood of developing heart disease. Genetic testing can provide valuable information for both patients and healthcare providers, guiding preventive measures or early treatments. While not all cases of heart disease are hereditary, knowing one's genetic predisposition empowers individuals to take proactive steps toward prevention. Regular health checkups and preventive screenings. Maintaining regular health checkups is essential for early heart disease detection. Routine blood pressure checks, cholesterol tests, and blood sugar monitoring are simple yet powerful tools for assessing heart health. These screenings are particularly important for individuals over the age of 40 or those with multiple risk factors. Regular monitoring allows doctors to detect changes in risk factors over time, paving the way for early intervention. In addition to checkups, healthcare providers recommend lifestyle modifications, like eating a heart-healthy diet, exercising regularly, and managing stress. Taking an active role in one's health through preventive screenings and lifestyle changes can significantly reduce the need for more invasive procedures. Thank you for joining us today on Expert Living to explore how heart disease can be diagnosed early and which tests are the most effective. Remember, early diagnosis is a powerful tool that empowers you to protect your heart and live a healthier life. If you found this information helpful, please hit the like button, subscribe to our channel, and tap the bell icon for more life-enhancing health insights. Take care of your heart, stay informed, and we'll see you next time on Expert Living.